The LA Trust means a lot to me. With those group of people, done for me, I will never forget.
For me, it means opening up to opportunities. Like, for example, presenting in front of an audience. I never thought I'd be able to do that.
Even though LA, it's a big city, there's so many things that happen. At the end of the day, we're all family and we're all community. I am proud of working with the LA Trust.
So the relationship between student health and their abilities to succeed in school is evidently clear. Being able to actually bring healthcare to campuses, integrate that in the school day is something that will solve the problem for educational inequity. And this is where the merger is important.
Only when we have healthy kids, our nation is going to be healthy. And we have so many studies that have shown that healthy kids are better students.
We're not the school, we're not LAUSD, we're not the clinic, but we are connected and we connect all of those entities. Having a wellness center on campus, it creates easier access for the students.
The door is open to the community so we can serve parents and families, and it's also open on the campus side. So teens can come in, not disrupt their school day, and also have access to minors' rights services, such as reproductive health services and mental health.
The kids feel much more comfortable because of the campaigns the advisory board is doing and also working with the students in the schools. They are feeling more comfortable coming into our clinics. So that is where LA Trust is really helping these kids.
Our youth advisory boards, we've been operating these for about 10 years now, but the concept is that young people who are selected from their campuses will actually drive prevention, education, and activities on their campus that are related to the issues of that specific community.
You definitely get a different dynamic when you have youth teaching other youth. Just think back being a child when your mom or a parent would tell you something, you don't want to hear that, but if your friend told you, you're going to listen. It's not just us talking at the youth, it's us engaging with the youth to empower them to teach their peers and also their community.
In campus, I had students who were asking me questions like, hey, I heard that you're with SAB. I'm like, yeah, I am. And they're like, do you know where I can get a physical? I'm like, yeah, we have a wellness center. Just call this number and set up an appointment and you'll get your physical.
I would make posters, do videos. It helped me kind of get out of my shell a little bit.
For the first time ever, I managed to have a conversation about an issue, which is e-cigarettes. I had managed to have that with a team of mine, my volleyball team, and then he was interested to learn about the dangers of e-cigarettes. So I was telling him the stuff that I learned from them.
We were able to pull together a data exchange that actually takes medical information from the community clinics, the dental providers, the mental health providers, and intersects that with LAUSD's attendance and student academic records.
It is exciting to wait and see what is that data exchange impact is going to be on what we are going to be seeing and how to provide services for the children.
We have incredible need in LA, and I think we have an incredible responsibility to actually do that and respond.
It's training a lot of people. It's training students, it's training the people who are working for SAB, but definitely it's going to impact our future in a great way. I feel that the people that I've met here are going to be a part of my life in the future, and I thank them for being a part of my life.